Looking for help? Great, because I'm here to explain the risk factors and warning signs of suicide and why it's never the option. Here we go. So, suicide is always a shaky topic and could always be caused by work, friends, and even family. Usually, depression is the number one sign of suicide. Depression is almost always undiagnosed and untreated and can lead to substance abuse, increasing the risk for suicide. Something to look out for most people are changes in behavior, moods, and the way they talk. Behavioral changes include increased use of alcohol or drugs, looking for a way to kill themselves, such as searching online for materials, acting recklessly, like if they don't care about anything, leaning away from activities, isolating themselves from family and friends, sleeping too much or too little, saying goodbye to people randomly, giving things away, and aggression. And for some reason, if the person you know or you yourself are just normally like this, look out for the way they talk. If someone is going to kill themselves, they begin to call themselves a burden to others and how they feel trapped and are experiencing unbearable pain. Something else they could say is they have no reason for a living and are going to kill themselves. Now that's an obvious giveaway. For their mood, the thing that can give it away the most, they can be depressed and lose interest in many things. They can become anxious and filled with rage and even humiliated. Now to talk about risks. What exactly are suicide risk factors? Well, risk factors are characteristics or conditions that increase the chance that a person may try to take their life. Earlier, I mentioned that some reasons of suicide come from work, friends, and even family, but there's a lot more to it. Suicide risk factors can include health factors, your environment, and historical factors. When it comes to health and suicide, there's a lot that plays into it, especially mental health. Because the brain controls so much of what you do every day, things like depression, a bipolar disorder, schizophrenia, borderline, conduct disorder, psychotic disorders, or anxiety disorders can all push you to do unthinkable actions. These are all effects of different factors though. Substance abuse can all cause many of these disorders. This is a big reason why your loved ones want you to stay away from drugs. A lot of this comes from environmental factors as well. Let's say you're doing well in life, but all of a sudden a lot of stress is put down on you. This stress could be from a death, divorce, or a job loss. If this isn't the cause of your stress, then it could come from your insecurities. Prolonged stress from harassment, bullying, and relationship problems could all lead you to start questioning yourself. The biggest problem with stress is the exposure to firearms and drugs, which are all horrible to be near when you're feeling down. Usually, people who have the mentality of putting themselves down start to expose themselves to other people's suicides. And last but not least, not only is it caused by health factors, mental health, and environmental factors, but it's also caused by historical factors. If a person has already tried to take their life but has survived, this could lead them to many more attempts. And if it's not them who has tried to kill themselves, it could be someone else's attempt that influences them to attempt it themselves. Suicide is never the answer. If you truly cared about your loved ones, you would not leave them in grief. Help is always around, whether it be an adult, a friend, or the National Suicide Prevention Lifeline. If you or anyone else you know is in need of help, call 1-800-273-8255. Thank you.
Created using Powtoon.